Drug hauls have become a common news story in Meghalaya, and so is the problem of drug abuse. While the Meghalaya police are cracking down on peddlers and drug dealers, leading to huge drug hauls, the problem of drug abuse has become a major issue. According to a 2025 study published in the Indian Journal of Public Health, initiation of drug use starts as early as 10 years of age. The reasons are manifold. Sometimes it is peer pressure, sometimes it is just curiosity. At times it is family problem, and sometimes it is just de-stressor. Small experiments and fun start with drugs like nitrosum, spasmo-proxyvon and alprazolam and go up to marijuana and heroin and cocaine. While drugs like nitrosum, popularly known as nitro, and spasmo-proxyvon are still affordable, drugs like cocaine and heroin are really expensive. So how do these youths fund their addiction? Those who come from economically unstable families get into the vicious world of petty crime to support their addiction. For instance, there is a young man in his early 20s whose family I happen to know is an addict. He works in the unorganized sector and his income is not enough to support his addiction. So what does he do? He steals from his mother. This is the common turn of events for all drug addicts. In Meghalaya, crime under the Narcotic Drugs and Psychotropic Substances Act rose from 69 in 2021 to 189 in 2023, according to the police data. This is an increase of about 174%. Another cause for concern is the rising cases of HIV because of the rising use of intravenous drugs. The HIV cases in Meghalaya increased about 221% in the past 19 years. The numbers are worrisome. But what is more concerning is that drug abuse is leaving a debilitating impact on a generation in Meghalaya. It is laudable that the Meghalaya police are cracking down on peddlers and drug dealers. And there have been several seizures worth crores of rupees. But that is not leading to a let-up in drug use or drug abuse. How are these users getting heroin or cocaine in the local market? Most of the arrests which are made are of small-time peddlers and small-time drug dealers, which are just fries in the entire drug business network. To stop or at least to check this entire network to spread its tentacles in the state, the Meghalaya police have to work with other police departments in other states. It is a huge network, and the Northeast region is a vulnerable place when it comes to drug abuse and drug business. So the police departments of all the northeastern states have to work together to fight this menace. Of course, the Meghalaya government has been taking several measures to make people aware of the problem and to engage the community, educational institutes, families to fight this menace. It is training community members, teachers, and making students aware of the drug abuse. But this network has to be strengthened so much so that every affected family can reach out to community members for help. For instance, the family of the young man that I spoke about earlier could have reached out to a community member for help and immediate rehabilitation of its child. Drug abuse is the darkest menace in a society, and every stakeholder has to be well trained and well aware of the evolving drug business scenario in the state.